If you're out there in the internet world looking up shoulder injuries, I'm going to explain to you what happened to me. Tomorrow I go in for surgery. So, what is my injury? I have a torn long head of the biceps tendon. And I have two full thickness tears of the rotator cuff muscles, the supraspinatus and infraspinatus. My best description of what it felt like was if you were to take a sheet of tinfoil, put it underneath your skin in your shoulder, and then like crumple it up, that crackly crunch, I felt it, I could hear it. It wasn't a snap pop, but boy did I feel the pain that went with it. Now this happened about 10, almost 11 weeks ago. It's taken me this long before I actually got clear to go get surgery. I'm going to take my shirt off here, which of course, if this was the injury that just occurred, I would have a heck of a time trying to take my shirt off. But like I said, 11 weeks into it, I can move a little bit better. It is my left shoulder, so that's going to be this side. And yes, you start to get pretty good at learning how to take off and put on your shirt when you've lost the use of your arm. Okay, supraspinatus, infraspinatus. Now, my particular infraspinatus, if you can see, especially kind of this area here, you see how this whole area is kind of bulging out or puffy? That's not swelling. That's actually my infraspinatus. It's kind of detached and it's retracted. So that's not a good thing. Right there. And that needs to come up and tie back on. To my shoulder. So if you look at my other side, it's nowhere near that. This is kind of flat. But this side is puffy. And that's because the muscle has retracted. Hopefully when they put me back together, and I sure hope so, I can lift my arm and get full usage again. If you're out there and you've had a similar injury, all I can say is, I feel for you. I tend to be left-handed, but I'm a very active person. I do a tremendous amount of lifting, former bodybuilding, powerlifting. I can't do any of that stuff right now. Shoot archery, can't do that. Anyhow, that's the scoop. Show you how wonderful it is to put a shirt on. We'll see what happens when I come back from surgery. I'll try to maybe do some follow-ups as far as what happens with the surgery process, and then ta-da, putting your shirt on. What happens after the surgery, and then possibly going through all the therapy, and I sure hope to get back to where I can get full range of motion and full functionality out of my arm. So thanks for tuning in. This is video number 1, the night before my surgery, rotator cuff surgery, supraspinatus, infraspinatus, origin of the long head of the bicep tendon. Those are the 3 primaries. All right, thanks.